Chair, Commissioners, Mr. Lewis, Rich Collins, Emergency Services Director. I'll try to tie together a bunch of things that have been occurring from the EOC that relate back to both Mr. Lewis's and Chuck's comments. I'll start off with 42 days ago on February 27th, the EOC and the emergency management team began leaning forward in support of the COVID-19 response. And on March 16th, 24 days ago, the EOC went to level 2, operating 7 days a week with a staff, minimal staff in the EOC, and we've continued to try to drive that number down and have basically the leadership team there operating, and as many as possible working remotely through social distancing. And a large part of that effort, and I think I want to highlight through each one of the areas, the tremendous work being done by the various departments. Our EIT team has been phenomenal in working with us and getting remote access, building Teams accesses with our staff so that we can operate with a minimal team of leadership from the EOC. As Mr. Lewis mentioned, everyone is a first responder to support the community for COVID-19. And so I'll highlight a few of the departments and things that have been going over the last several weeks. I'll start off with fire and EMS. As I talked about last meeting, we were in the process of implementing 3 rapid response vehicles to support the operation. We're at 4 rapid response vehicles that are on average. I think yesterday they responded to 75 incidents related to response throughout the community in support of this operation. We're responding to about 20% of our calls are, whether it's a first response vehicle or an ambulance, responding to a medical call related to flu-like symptoms or respiratory illness that could be associated with COVID-19. We have done several things to try to maintain operations. The fire chief and the team have been doing a phenomenal job to support our first responders who have just been doing incredible work, both law enforcement and fire, responding daily throughout the community. We've separated fire and EMS as of this week, so our EMS teams are working and our fire units are staying in the station so that we can maintain the level of support for not just fire operations, but in case we have sickness, we can continue to provide support to the community. We've instituted heightened PPE to support our first responders. We have at this point just a handful of our firefighters or paramedics that are in some type of quarantine at the moment. On a daily basis, the fire chief is meeting with all of the fire departments virtually to talk about what the response is, what their issues are, critical needs for personal protective equipment, and doing the same with law enforcement as we meet on daily conference calls with the city constitutional partners, our directors across the county, as well as the executive policy group. Our bus operators are doing a phenomenal job, and the team at SCAT has done a number of things to continue frontline service to the community on a modified Saturday schedule. They have strategically and thoughtfully developed a plan that allows us to look at ridership, and if we see any of our operators or people being sick or we need to scale back operations, they have done that through ridership and have a thoughtful plan for implementation if we need to move that way. I know Chuck has talked about the health team, but working together, health, Parks and Rec, the fire department, and the sheriff's office, we instituted the drive-through testing that Chuck talked about. Our libraries team is working and has spun up production of cloth masks at a goal of about 1,600 a week to support what may be needed within our employees. Utilities and Public Works, as Mr. Lewis mentioned, continue to provide service to the community, and we've waived shut-off fees in utilities. And as Chuck talked about, we've produced a heat map that's being used as a planning tool. He talked about it, and I'll add a couple of other things that we're monitoring to Commissioner Ziegler's point. This is about a day old right now. I think it'll be updated later this afternoon, but Doctors Hospital is at 38% of ICU beds occupied. Sarasota Memorial is at 79%, Venice at 25%, and Inglewood at 50%. Resource-wise, across the area, we have 56% of our beds occupied. As we look at isolation, which gives us an idea of how many COVID patients we have in the hospital or people who may be suspect or being taken care of for that. Venice is at 100% of their isolation rooms. Sarasota Memorial, it has 33 rooms. They're at 101 rooms where we have patients that they're taking care of, and Inglewood at 50%. And I think it's also important, as Chuck mentioned, highlighting our elder care facility. So on every day, Chuck's team is contacting and maintaining contact with those elder care facilities. And we have a current census of 6,300 total patients in our clients in those residences. We have 18 confirmed cases. We have residents and staff under investigation, 28. And so we're monitoring those things on a daily basis as well. I do want to take a couple seconds and talk about one of the primary components of the EOC, and that's coordination of critical resources in the community, which goes back to things in this case, which would be things like personal protective equipment, the various equipment that we may need to support the operation. And so since this began, we've had 244 private requests through the state. That's be through private elder care facilities, group homes, things that need help. And we have 35 open requests. We've distributed to over 100 healthcare facilities. On a daily basis, the team is talking about who has the most critical needs for various types of PPE. And we've received 9 state shipments. We've had 7 direct shipments to Sarasota County hospitals or agencies. We've distributed through the logistical staging area 14,650 N95 masks, 64,000 procedure masks, 5,000 face shields, 4,000 gowns, 90,000 gloves, and that 217 sanitizers. We have an order of 180 gallons of sanitizer coming in. And so this is just an idea of what's coming into the logistical staging area and what we're pushing out. At the moment, I am not aware of any specific agency that has a critical need that has not been met. And if we do get a call where somebody has something that's coming down to a critical point, we work directly with Chuck's team and our logistical unit and to get those supplies out to them. I do want to take one quick other moment to talk about some of the other things that are going on. Our school district has done a phenomenal job of feeding at 7 locations at different schools and have served over 28,818 meals to date. They're doing a phenomenal job. Our COAD team with Health, Human Services, Emergency Management is tracking, coordinating, and planning if we get into an area where we need to provide vulnerable feeding to those that are in a vulnerable state. They are monitoring community feeding on a daily basis through the Salvation Army, Meals on Wheels North, Venice, Northport, and Inglewood, and also monitoring 211 for needs coming in, and that's giving us an idea of what's going on in the community. And they have developed a plan for feeding and instituting various feedings at meals over 30,000, 60,000, and up to 90,000 a day if needed. And they're coordinating with All Face Food Bank, our local grocers, and of identifying any potential supply chain need that could affect one of those vulnerable populations. As Chuck also mentioned, we're working on non-congregate sheltering. So if we have first responders or employees are in critical areas that need to have sheltering for isolation or quarantine, we're working through FEMA on that and working through Chuck's team for those that may not have the ability to isolate and taking care of them. Finally, of course, as Chuck has mentioned, we're working with the health department, the hospitals, and the state on planning for any surge capacity needs, and we continue to coordinate with our city and constitutional partners. I know I packaged a lot there in a quick time. Hopefully it was good information for you to help you understand the work that's going on by the leadership team in the EOC.